So my name is Robert Cousins. I'm the Superintendent Pharmacist for Instinct Healthcare Pharmacy. The UTI service is an advanced service through the Common Ailment Scheme. Uncomplicated urinary tract infections for women can be easily treated in community pharmacies. So the UTI service is designed for female at birth patients between the ages of 16 and 64 who are generally fit and healthy and deemed as uncomplicated. You access the service through your community pharmacy. Every community pharmacy is different, so I'd recommend asking a community pharmacy. If the community pharmacy doesn't offer the service, they should know which community pharmacies in the local area do, but there's generally pretty good coverage across most of Wales now. Either patients phone up to access the service, which we advise just to make sure they're not wasting a trip, or if they call into the pharmacy. We then, obviously, depending on how many patients we have waiting or whether the service is available, that they advise the patient how best to access the service. That might not be straight away, that might require them to come back, but it might also have to require them to go to a different pharmacy that has availability that day. The member staff at the counter will then ask some screening questions just to make sure the patient's eligible for the service. Obviously, if they're not, we're going to have to send them back to the doctor's surgery or forward them on to an independent prescribing pharmacist in the local area who might be able to treat their patient. If they are eligible for the service, they'd be advised what the wait is and how long they can be seen or where to go. During the consultation, you'll be assessed by a trained pharmacist. The pharmacist will go through a number of questions just to assess your symptoms. And from that point, if needed, they can dip your urine just to check to see if there's anything in the urine that highlights, say, an infection and whether antibiotics might be needed. So in some cases, the pharmacist might deem that you might not need antibiotics, particularly in cases that have only lasted 24 to 48 hours, because often they're self-limiting. But with easy access to this service, patients are always able to come back in those next couple of days and access the service again if the symptoms are still there. To find out more information for the UTI service, the best place to go is on the NHS 111 website. On there will not only be the patients who are eligible for the service, but also the pharmacies in your local area that are offering the service.